Hello and welcome to Friendly Pharmacy 5. Today I have Shelita Dattani with me. Shelita is the Vice President of Pharmacy Affairs for the Canadian Neighbourhood Pharmacy Association. Shelly, thank you so much for joining me today.
Thanks, Lindsay. Happy to be here.
So, Shelly, we have been experiencing quite a few drug shortages in Canada. Now, this has been going on for many, many years, but it seems like this year it really caught the attention of the media, and the public is now quite aware of it because this has now affected the other side of the counter. So we've seen children's Tylenol shortages, we've seen cough and cold medication shortages. So could you just tell us a little bit about maybe what your role is and how medication shortages plays into this, and maybe why we are experiencing more, or it seems like we are experiencing more medication shortages this year as compared to other years?
Yeah, it's a great question, Lindsay. And my role is I lead our advocacy work at the Neighbourhood Pharmacy Association of Canada. So all of the work that we do at Neighbourhood Pharmacies is around enabling pharmacy as a community health hub and all of the contributions that we now make to community-based care. I've been involved with drug shortages, though, for a long time in my career, sad to say, actually. Previous to this, I worked at the Canadian Pharmacist Association, and I, worked on the drug shortage file. I worked as a consultant for a group purchasing organization, and drug shortages were paramount in part of my work. And before that, I worked in hospital pharmacy. And I still remember the day in 2011 where there was a massive generic parenteral drug shortage, and it really rocked our world. So drug shortages have been a part of my life for I guess 12 years, and probably a part of a pharmacist every day. And we know, Lindsay, that community pharmacists spend almost 30% of their time just managing drug shortage issues with their patients behind the scenes. And most of the time, people don't even really know that because they're just quietly managing things. And we also know that our community force, our pharmacist force, our nursing force, all of our healthcare providers are stressed and overloaded and need to be spending time taking care of patients rather than mitigating all of these challenges. So we do need to do something about this, not just to take care of our patients, but to take care of our providers, to ensure that, everybody can get that patient the right medication at the right time so that they're not disrupting their continuity of medication therapy. I guess the other thing that I think about with drug shortages is that they interfere with, that continuity of therapy, but they also really disrupt the work, of you, Lindsay. When you're working in the pharmacy or when I'm working, we're looking to find substitutes. We're trying to just get patients what they need. We may be back and forthing with other healthcare providers. Sometimes they drive up the costs if alternatives are more costly or if they're not covered by insurance. Think about those pharmacists who are compounding acetaminophen suspensions even into late last year, and those weren't always covered by people's drug plans. So they've been challenging for lots of different reasons.
Yeah, and I think the time that it takes, that also gets passed on to our patients. And like you said, the cost, because when you compound a medication, there usually is an added cost, but also that medication is not necessarily going to last as long, such as the compounded acetaminophen. So you're paying a massive amount of money for something that is maybe only going to last a week or two because it's not preserved as well, right? So it does create a real problem, right? And we saw that, it was in the public, it was in our face. We could not ignore it with the children's acetaminophen, right?
Yeah.
So this year, it seems like, I mean, obviously the media has caught this, so we are seeing it more and hearing about it more. But is this year worse than other years? And what has occurred for it to have caught the media's attention and for us to be seeing some shelves that are empty out in the over-the-counter aisles in the pharmacy? What has happened here in Canada?
Yeah, it's another great question, Lindsay. And, this has been a very publicly visible shortage. So I don't want to diminish the huge impact to parents and the huge impact to children of not being able to access supply of pediatric analgesics. I mean, I'm a mom, you're a mom, we really have seen, I think, a lot of that sort of more publicly visible impact of this particular shortage. And it's been stressful. It's stressful on parents and stressful on pharmacy teams. There have been, there's been lots of media attention. There's been Facebook groups of parents trying to look for medication. There's been letters that have come out saying, we need a prescription now for this. There's just been compounding challenges, I guess, pun intended or not intended. And so I think this is what it was. This has been the most visible, I would say, drug shortage that I can remember in my memory. Although we know that, again, as we said, pharmacists have been managing shortages behind the scenes for a long time. You probably remember the valsartan shortage just a few years ago. It's probably the patient in front of you didn't even know about it because you were just managing it, but it still took a lot of your time.
Mm-hmm. Yeah. And as pharmacists, this is something that even early on when I became a pharmacist, I could not believe the amount of time that we had to dedicate to changing a brand, to sourcing medication, to, sometimes even changing a prescription or reaching out to a prescriber. It really does have an impact on pharmacists and on other healthcare professionals, as well as the patient themselves. Is this a problem that is unique to Canada, or are we seeing this happen globally? What do you know about this?
Well, drug shortages the drug supply chain is global, right? So, yeah. Drug shortages are not just a challenge in Canada, they're a challenge around the world. And I'm going to take you back. I was listening, Lindsay, this morning to a podcast that said it was like today, 3 years ago, that in the US, they declared a global public health emergency. And shortly after, as you know, we declared a global pandemic by the WHO, just like 3 years ago, which seems like an eternity, but just yesterday. And you'll remember back then, starting with toilet paper, we saw the increased demand with toilet paper, but then we saw increased demand for other medications. And a lot of them were symptomatic treatments that you might use in the ICU, for example, because people were really, really sick with COVID. And so things like propofol or Ventolin inhalers were being used. And so we really worried about drug shortages. And then you remember, Lindsay, that 30-day drug supply that we put together in pharmacy to reduce some of that stress on the supply chain. So I think it's important to remind people that this was just one piece of the supply chain that we were trying to mitigate. I mean, the shortages are global, and sometimes pharmacists become sort of those unappreciated custodians at the end of the chain, at that last mile before the drug gets to the patient. But the complexity of that global supply chain is really important to understand. So, the recent analgesic was a little bit unique. It was initially, unique to Canada. As I said, it was compounded by media, high demand, symptoms due to, respiratory illnesses, and then probably a little bit of public panic as well. And so, all of those things together created a little bit of a perfect storm. So we were able to secure some foreign supply, as you know, of these analgesics, but then you saw some trickle effects, like in the US and in the border towns, they were also short. Other shortages, like the amoxicillin shortage is one that I'm thinking of right now, is a global shortage. So it really is important to remember that the supply chain is much bigger than us. And usually those shortages impact many, many countries.
Mm-hmm. And I know that Canada is a smaller market, say, compared to the United States and the population that they have. Does that ever work against us as far as our purchasing power, or how does that play into our drug shortages here in Canada?
Yeah, it's a good question. Again, there's medications, as I said, come from, 80% of them come from India or China through the active pharmaceutical ingredients. But it's hard to say. There are definitely global factors that impact the supply. So I wanted to sort of stress, Lindsay, when you asked about us in Canada, I think it does, it is important that we're a small market. And it's important because it puts us at a little bit more risk potentially and makes us more vulnerable to all of those different pieces that can impact the supply chain. So whether it's something in the drug manufacturing process, which is really important. I mean, you go from manufacturer to distributor to pharmacy to patient. You might have public health involved in distributing. I mentioned group purchasing organizations. Physicians are part of that drug supply chain. So I think it's really important to understand that the supply chain is broad and involves a lot of different touch points. And at any place you might have a hiccup, like if you have a recall, or if you can't get raw material, or like just as we've discussed, you have increased demand, or you have a natural disaster. We've seen that happening too, or you have a pandemic, which is the perfect example. These things all can impact, how accessible a drug may be to a patient. So whether it's a back order or a recall or a shortage, it's a complex process. And then there's external things. So there's payers, and there's governments and regulators, and there's competition, and there's people can go on strike, and there's emergencies again that we've seen. So it's just all of those different pieces that can be vulnerable. And the pandemic really highlighted that vulnerability. So bringing it back to Canada, thinking that shortages are global, and we have a pretty broad supply chain with lots of different players and lots of different touch points that I've just illustrated. And shortages are multifactorial. It's not just A equals B. It's complex. We are a little bit more at risk because we're small. And so thinking about how to protect the security of our supply chain is really important. Thinking about how Canada needs to be an attractive market for manufacturers is important. There was a paper that came out in the Canadian Medical Association Journal a few years ago that said that markets with a single generic manufacturer might be more likely to be in shortage.
So we know that there's been some restrictions on drug pricing in Canada over the last, say, 5 years or so. Maybe it's been longer than that. I'm not exactly sure. You would know better than me. How have those restrictions impacted us here in Canada, and how do they impact our ability to acquire these, say, generic medications or others? Has it negatively affected us in any way?
It's difficult to definitely draw some of those links, but, and this is a really interesting area that I'm learning more about as I think about how policy impacts patient care. So when you think about policymakers, and, they have to balance cost containment, right? So nobody wants to pay a lot of money for their medications. You don't want that. I don't want that. We don't want high drug prices. But you have to balance that with the security of the drug supply too. So that's not an easy task. So we have to think about that. So if there are tight profit margins to the manufacturers, and they're under a lot of pressure because there's price capping policies, as you said, that can introduce some risks. So we need to understand that a little bit better, and we need to study it a little bit better. One of the things that some people have talked about is, can we prioritize things? So can we prioritize the shortages that pose the greatest risk to patients? So we were talking earlier about the valsartan shortage. Like, did you know that 200,000 Canadians were affected in a single month by the valsartan shortage? We didn't hear arguably as much about that as we hear about pediatric analgesics. And again, not to minimize how impactful that's been, but just to sort of showcase that these are things that we've been dealing with as patients and healthcare providers and pharmacists for a long time. So taking that approach, that's sort of what I call a whole of government approach, and looking at what are all of the upstream challenges in that huge supply chain that we described that can impact drug shortages, including price capping policies, including some of these other challenges. So rather than be reactive every single time we have a shortage and panicking and telling people not to panic buy and putting pharmacists in stressful positions to find alternatives, looking at that big picture, like you said, is really important. So I could talk about, at Neighbourhood Pharmacies, we sit on the multi-drug stakeholder shortage committee. So we get together with a lot of people. Health Canada has sort of this table where we talk about some of these supply challenges, and we have people all through the supply chain. We have patient groups sitting at that table. And recently we've been invited to a roundtable with the health minister a few months ago, because this became such a huge public issue, as we talked about. So we bring that feedback there, and we look at trends. And we look at some of those challenges from everybody's perspective. So really encouraging everybody to, sort of think about all of the different pieces that could contribute to a drug shortage as part of the conversation that we have.
Mm-hmm. That's an excellent explanation. Thank you for that. So when we talk about trying to be more proactive, I think that there's a couple things that come to mind for me. So we have the pharmacist and what they can do, and we know that that's a little bit different depending on what province you live in. And then we also have the side of how can we prevent these shortages from happening in the first place. And you've just explained that it's a lot more complex than just, making a couple of decisions, right? But from your perspective, as far as pharmacists go, you're in Ontario, I'm in British Columbia, and we have not pharmacists in BC cannot do exactly the same things as pharmacists in Ontario, and this repeats throughout the country. So can you just kind of give us a bit of an overview as to how maybe pharmacists could be better utilized when managing these shortages, and how we could better serve our patients kind of on a national level, but then also what conversations are happening at these tables, and what kind of solutions may be being proposed to help mitigate or help to be more proactive about these issues?
So I'm going to kind of flip the question a little bit, if that's okay. And maybe I'll talk first about some of the big picture kind of proactive solutions, because it kind of flows nicely from the last piece that we were talking about. And then I'll get into, at the level of the pharmacist, what do we really need to do? Because ultimately the goal is the same. The goal is not to interrupt patient drug therapy, right? Yeah. We want patients to have that continuity of therapy. And we know how scary it can be if you can't have access to Tylenol and you have a child with a high fever. I mean, that's one of the scariest things. Or if you have epilepsy and you don't have access to valproic acid, which was a challenge a few years ago. So I think a couple of things I would say. One is that, I've just sort of tried to illustrate how complex the supply chain can be and how it involves several different touch points. So the whole is always greater than the sum of its parts, right? So as much as we can be transparent throughout the supply chain, from the manufacturer to the distributor and wholesaler to the pharmacy to the patient, so that we understand the data, or we understand some of the signals that there might be challenges upstream, and we can proactively address those, so we can, whether it's warning alerts or whether it's a priority list of medications that we always make sure that we have supply upstream. There's lots of different, avenues to look at. Also, one of the things that we did at Neighbourhood is we advocated for foreign supply early in this most recent drug shortage with the pediatrics, because we knew that at least initially it was contained to Canada. We have to recognize that we can't, that's a bit of a Band-Aid approach. Like, you can't just keep saying, okay, we'll just go get supply from the US or Australia. But that is something that we early on said, there's only so much we can put purchase limits. And Lindsay, you'll appreciate this. There's only so much at the pharmacy level we can say, you can only buy one, or the shelves are empty, or don't hoard. When there's nothing left to hoard, you can't say don't hoard. So getting that foreign supply in when you can is a somewhat reactive, but still something to think about. And then, as we just talked about, really advocating for a more collaborative, sort of interconnected approach to what really does affect access to medications, whether it's policy or practice, and connecting those dots, which are some of the conversations we've been having more recently. And then also just getting some data to really understand and build the evidence base around where are we going to get tripped up in the supply chain, where there are vulnerabilities, and how can we then inform policy development through that data. So, there's a lot of things that you can do and explore, but we definitely, as you said, this does have to be a national priority for Canadians. We have to have access to critical medications all of the time. And so we do need to be able to understand what those are, so that, either we can amplify our domestic production if we're able, or we can work closely with other countries that produce to make sure that we're ahead of the game instead of reacting to a shortage. Now, Lindsay, you asked, well, what if we do have to react? What if we're in reactive mode and we're there, you and I, you especially, you work on the front lines more than I do, but I'm there at least once a week when I'm working in a pharmacy environment. Is if we do have to be reactive, how can we empower pharmacists at the point of care to be able to seamlessly take care of their patients, so they don't have to feel the impact like we are? And one of the things that we can do is enable therapeutic substitution, which actually is something that I believe all pharmacists should be able to do across all provinces. And I believe all patients should have access to. Is it fair that a patient in Ontario can't get their ACE inhibitor automatically alternated from me, but they can from you because you're in BC or Alberta or another province that has therapeutic substitution? So I think that's something that we've talked about at the federal tables, at the ministerial roundtables, is, like you said, Lindsay, asking pharmacists to compound medications on top of all of the other work that they're doing and just trying to take care of patients and still inside a pandemic is challenging for all kinds of reasons, like whether it's access or whether it's cost, or you spoke to beyond use state. I mean, we're not manufacturers, we're pharmacists. So we really need to be able to practice to full scope. And one of the ways that we can do that for some of these shortages is to be able to prescribe substitutions or alternative medications so that we're not faxing back and forth to get a patient the right medication. That takes an inordinate amount of time. So that's sort of an important piece, I think, that we still don't have. And we recognize that this is under provincial purview because scope of practice is provincial for us as pharmacists. But we've been talking about that at federal tables, and we've been talking about it at some of the provincial tables we sit at too, and saying, therapeutic substitution is just good for patient care, but it's also good to help manage drug shortages.
Yeah. And one of the questions I had from a pharmacist recently, and this is something that we do struggle with in the pharmacy on a daily basis, is often these drug shortages will happen and we will realize that a medication is shorting. But as community pharmacists, we don't know why. And we don't really get the communication from the manufacturer, from anyone really. And so when the drug is short, we're telling this to our patient, we're trying to explain this, and they're asking why. We're not necessarily, we don't really have an answer for them. So have you had any conversations, or do you know if manufacturers or distributors even could make maybe more of an effort to communicate with community pharmacies, or how does this look from your side? Because I've been hearing from pharmacists that it would be helpful to be able to just have some kind of an explanation, and maybe sometimes we do get an expected date of when a medication might be available again, but we know we can't always rely on that date either, right? So is there any efforts to maybe improve the communication so we can even pass that on to our patients?
It's such a good question, Lindsay. So it's not enough to say, I'm going to help you manage the drug shortage, or I'm going to tell you there's not enough, or be the bearer of bad news. But your patients want to know why, and you want to know why. It's a really, really good question. So a couple of things that I'll say to that. Health Canada started a website called the drugshortages.ca website that you're probably familiar with, where manufacturers are mandated to report their drug shortages. I think there is some opportunity to collect some data from that website, but there's also some opportunity to make that website more robust, to understand which shortages impact patients and providers the most, and give us a little bit more information. So I agree that that would be a great place where pharmacists could just go and look and get a little bit more robust information. And that's feedback that we've given directly to Health Canada and said, this was a really good thing to start this drugshortages.ca website, but now that we're, 6 years in, are there ways that we can improve it so that we can be, as I said earlier, really transparent all the way from manufacturer to patient level about what's going on with shortages. And we've certainly advocated for that at the federal level when we're talking to manufacturers, and I definitely think that there's lots of room there to improve that site and leverage it so that there's an understanding at frontline level of how to talk to patients about this.
Mm-hmm. Yeah, that's a really good explanation. I'm not sure all pharmacists would be aware of that website. I was on there today, and there's 1,800 medication shortages right now, right? So, I mean, the scope of this is quite huge, right? And I don't know if if people are really aware.
1,800. I mean, that gives you an idea of the magnitude, and most of those are quiet, right? I mean, the manufacturers are definitely doing their best as well. I mean, this isn't always a supply issue. Often it's just a high demand, as was with the most recent pediatric analgesic. But just really to your point, let's understand what's happening, and let's also not create assumptions, because that's what we tend to do if we don't really understand what's happening, right? That there's some sort of conspiracy theory on why we don't have amoxicillin or why we don't have enough adult cough and cold. So the more transparency we have, the less likely people are to make assumptions and or create a negative feedback loop where people will just go and hoard medication because they're worried that they don't really know the answer. So they're just going to go and buy it all up, which is the worst thing that can happen, right?
Yeah, exactly. We don't want that. Definitely don't want anyone to panic on any level. And then as far as managing drug shortages, so I can only speak for a community pharmacy because I've never worked in hospital, but I know that you've worked in hospital and you have a different perspective as well as community. So when we are managing drug shortages in hospital versus in community, it sometimes seems from our perspective as community pharmacists that it's a little bit easier for hospitals to maybe share supply or manage the supply a little bit easier than we can in community. Would you agree with that? And or what opportunities do you think might be in community for us to better manage our own drug shortages?
Well, I think that when I was in hospital, absolutely. I mean, we had a regional committee that was struck actually during the drug shortage time. And sometimes we're talking about like critical medications that are administered around a surgery that we would look for supply. We would share supply between hospitals. We would even share alternatives or, recommended alternatives or pre-printed orders. And certainly in community, there's lots of organizations that have developed really great, resources and lists for alternatives and things like that. I definitely think that collaboration between all of us is important. So, I mean, as much as we can do that, we want to get that medication to the patient. So as much as we can identify what those alternatives are, it's a struggle, but also a continued goal for all of us. Community pharmacy teams have spent so much time explaining alternatives, identifying alternatives, calling around, as I said, if they can't therapeutically substitute, going back and forth with a physician to identify an alternative. They really, really, I think my what I've learned from this is pharmacists go to bat for their patients, like whether they work in hospital or whether they work in community, and it takes a lot of time. So how can we be a little bit more seamless if we have to be reactive again in taking care of those patients, whether it's therapeutic substitution or collaboration between different, hospital pharmacies or community pharmacies, or whether it's, identifying alternatives or just reassuring patients that it's going to be okay and you are going to help them. So, I mean, my one message would be to any non-pharmacists who's out there watching, be kind to your pharmacists because they really are there to steward your medication therapy and help you. And my message to governments and others would be, help us help you and enable us to make it a little bit more efficient to get that patient to their drug therapy more quickly through scope or other ways to do that.
So Shelly, you said a lot of important tables with important people, and you're having conversations that are really significant right now and will affect the future of Canadians and of healthcare in Canada. And so I know you can't tell us everything, but what can you maybe reassure us about or let us know about what solutions are maybe possibly coming, how we should feel in terms of the future of drug shortages in Canada? Could you give us a little bit of a inside scoop on what's going on and what we might hear about in future?
Well, I don't know if I have inside scoop. I try to share as much as I know, but what I do know is that drug shortages have been here for a long time and they're going to continue to be here. So I don't think we can expect that we're going to have zero drug shortages, but I do think that we can do a better job collectively of seeing the interconnectedness, as I said, of whether it's pharmacare or other types of health policy or scope of practice or, priority lists for medications, of trying to identify the interconnectedness of everything in health and how we can upstream protect ourselves a little bit better, especially for some of those more critical shortages like basic antibiotics and pediatric pain control medication and things like that. We don't want to be in those situations where, our patients are just worried. It's like 7 o'clock on a Friday night, and Lindsay, you've got a mom in front of you who just can't control her child's fever. We don't want to be there. So I think that understanding the interconnectedness, and from my vantage point, I guess I'm starting to really appreciate over the last 2 years how, federal policy and government and provincial work and, the work of individual healthcare professionals, how it's all connected and how we have to have those more holistic conversations in health about protecting access to drugs, access to drug supply, but also access to the pharmacists that can help navigate good drug use through scope of practice. So, I think that pharmacy services and scope goes hand in hand. The drug is just as good as how well you use it. So I think that's important as well. So lots more to come on pharmacare this year. I think it'll be interesting to see where it goes. I think there's a lot of detail that we don't understand about, where this, when this bill is tabled, what the roadmap will be, and what's going to happen at the provincial level. But, stay tuned. It's always exciting and always a good adventure.
That's great, Shelley. Thank you so much for just taking some time and explaining some of these things to us. I know that the audience will be very appreciative to understand a little bit more about what's going on. Drug shortages are something that if they haven't impacted you, they are likely to in future. They do happen. They will keep going on. But it's good to know that there's people like you who are advocating both for pharmacists and for the health and well-being of Canadians. So really appreciate all the work that you're doing and the time that you've taken to so eloquently explain all of these things to us today.
Oh, thank you, Lindsay. And by the way, this was the most important and impactful table I was at today. It was a pleasure being with you.
That's lovely. Thank you so much, Shelley.